So hello students, coming to one more triangle which belongs to the anterior triangle. Now in the anterior triangle, we have already seen the muscular triangle. We have seen the Ansa cervicalis, which supplies the muscles in the muscular triangle. Now come to another very important triangle, that's the carotid triangle. Okay, we have seen the boundaries of carotid triangle, students. Let us just quickly go through it. The carotid triangle, yes, this is the carotid triangle here. What are the boundaries of carotid triangle? That's the sternocleidomastoid behind, that's the posterior belly of digastric, and the superior belly of omohyoid. Clear? The sternocleidomastoid, the posterior belly of digastric, and the superior belly of omohyoid. So this is going to form the boundaries of the carotid triangle. Carotid triangle. What is the floor of carotid triangle formed by? The floor of carotid triangle is formed by this muscle of the pharynx. We'll see this later in the pharynx, the muscles of the pharynx. That's the middle constrictor muscle of the pharynx. This muscle of the pharynx is the inferior constrictor. So middle constrictor, inferior constrictor, and we get a membrane here, which is known as the thyrohyoid membrane. Thyrohyoid membrane. So middle constrictor muscle, inferior constrictor muscle, the thyrohyoid membrane. So this forms the floor of the carotid triangle. Clear? The roof, skin, superficial fascia, investing layer of the deep cervical fascia, and the platysma. The platysma muscle comes here. So boundaries are clear, floor is clear, middle constrictor, inferior constrictor, thyrohyoid membrane, and the roof. So that's about the carotid triangle. Now, why is this so important? What are the contents of carotid triangle? The contents within the carotid triangle, we have a very important content, that's the carotid sheath. Carotid sheath. Now we've got this internal jugular vein, yeah, the deep vein in the neck. We always say internal jugular vein. We've got the common carotid artery. So internal jugular vein, the common carotid artery, and finally we have a nerve with them, that's the vagus nerve. Put in a sheath. What is that sheath known as? The carotid sheath. I'm put in a sheath, that's the carotid sheath. And who lies on the carotid sheath? Students, we have seen in the previous lecture, there's someone who lies on the carotid sheath, that's the Ansa cervicalis, right? So what are the contents of carotid sheath? Just understand this, that's a very important MCQ for you. Carotid sheath, I'll just mention it like this, carotid sheath. Who lies in the carotid sheath? The common carotid artery. Common carotid artery. Now students, you know what? The common carotid artery divides at the upper border of lamina of thyroid cartilage. You've got the thyroid cartilage, the superior border of lamina of thyroid cartilage. The common carotid divides into an external and internal carotid. The external carotid is going to pierce the carotid sheath and get out of the carotid sheath. So who will remain in the carotid sheath? The internal carotid artery. So content of carotid sheath is going to be the common carotid and the internal carotid artery. Remember, the common as well as the internal carotid artery. The vein is internal jugular vein and the nerve is vagus nerve. Vagus nerve together enclosed in a sheath, that's the carotid sheath. So what are the contents of carotid triangle? Number one, very important content is the carotid sheath, which contains the common and the internal carotid artery, the internal jugular vein, the vagus nerve. The external carotid artery pierces the carotid sheath and gets out of the carotid sheath. It supplies the head and neck. It gives branches to supply the head, face, and neck. So let us understand the branches of external carotid artery. A very important MCQ, students. The branches of external carotid artery, which lies, this all branches are given in the carotid triangle. Carotid triangle. So how do we classify these branches? Anterior branches. Anterior. The first anterior branch of external carotid is the superior thyroid. Superior thyroid artery. So the first anterior branch, the MCQ comes, the first anterior branch of external carotid, your answer is going to be the superior thyroid. The second one is the lingual, and the third one is the facial artery, facial. So superior thyroid, lingual, and facial arteries. These are the anterior branches. Posterior branches would be, one goes behind the ear. What is that? Posterior auricular artery, and one goes to the occiput. That's the occipital artery. Students, have you heard this occipital artery somewhere? Yes, tell me. Have we heard this occipital artery somewhere? Yes, in the posterior triangle. Contents of posterior triangle, we have seen this occipital artery. Very good. Excellent. Huh? Very nice. So posterior branches, one is the posterior auricular artery, the second one is the occipital artery. Medial branch. Medial branch is the ascending pharyngeal artery. Ascending pharyngeal artery. This is the first branch of external carotid. That's the first branch of external carotid. Remember students, if you get an MCQ stating the first branch of external carotid, your answer is ascending pharyngeal artery. And the first anterior branch is superior thyroid. Don't get confused. First branch, ascending pharyngeal. If the MCQ is first anterior branch, your answer is going to be superior thyroid. Very good. And finally, so anterior branches, posterior branches, medial branches, and finally we get the terminal branches. Terminal branches. Where are the terminal branches given? The external carotid artery enters the parotid gland. It goes inside the parotid gland and gives the last two branches. One goes up here. What is that? The superficial temporal. The superficial temporal artery. Yeah. And which is the other one? Maxillary. And maxillary. I'll write it here only. Maxillary artery. This maxillary artery enters the infratemporal fossa. It goes in the infratemporal fossa. That we'll see later in the other lectures, right? So these are the branches of external carotid. The terminal branches are given within the parotid gland. That's the superficial temporal and the maxillary artery, right? So these are the main contents of the carotid triangle. Now, something else. We get some tributaries of the internal jugular vein. What is the tributary of the internal jugular vein which comes from the face? That's the common facial vein. You remember the common facial vein drains into the internal jugular vein? Yes. So that tributary would drain into the internal jugular vein. That tributary we see in the carotid triangle. Clear, students? Anything else that we see in the carotid triangle other than this contents the carotid sheath, the branches of external carotid artery? Yes, anything else that we see? We see the common facial vein. We see the common facial vein. We see the common facial vein. Anything else that we see? Yes, anything else that we see? Any other nerves that we see? Vagus is a content of carotid sheath. Any other nerves that we see? We see the hypoglossal nerve. I'll just make it like this. We see the hypoglossal nerve in the carotid sheath. Okay. We see the hypoglossal nerve. We see the superior laryngeal nerve, which is given by the vagus. Okay, superior laryngeal nerve, which is given by the vagus, which divides into an external laryngeal nerve, external laryngeal and internal laryngeal. External laryngeal and internal laryngeal nerve, right? Clear to all of you, right? So what else do we get in the carotid triangle? One is a common facial vein which drains into the internal jugular vein. Anything else? We get the nerves here. We get the hypoglossal nerve. We get the superior laryngeal which divides into an external and internal laryngeal nerve. We also get the 11th cranial nerve. What is that 11th cranial nerve? That's a accessory nerve, the spinal accessory nerve. The spinal accessory nerve which supplies the sternocleidomastoid and the trapezius, which is a content of the posterior triangle. Yes, we find that nerve in the carotid triangle also. And also we find the sympathetic chain. So just remember this carotid triangle. This carotid triangle is very important for number one, the carotid sheath that we get here. Carotid sheath, that is what you are supposed to know. And the branches of external carotid artery. Branches of external carotid artery. Clear, students? I hope this is clear to all of you. Look at this slide here. So this is the common carotid artery. And where does this common carotid artery divide? That's a very important MCQ. The common carotid artery divides at the superior border. Superior border of, just remember this, superior border of lamina of, superior border of the lamina of thyroid cartilage. So the common carotid artery divides at the superior border of lamina of thyroid cartilage. It divides into an external and internal carotid. You can see the branches of external carotid. We have seen the facial artery, which in the face, the various branches of facial artery we have seen here. Clear to all of you? So this is the internal jugular vein. This is the common carotid artery. That's the internal carotid artery. You can see this nerve with them. That's the vagus nerve. So there will be a sheath here. That's the carotid sheath. And what do we get on the carotid sheath? You can see this loop here. Can you see this loop here? This loop is the Ansa cervicalis. Ansa cervicalis. That's the hypoglossal nerve that we see here in the carotid sheath. The hypoglossal nerve is the one that also we see in the carotid sheath. Clear, students? Answer this MCQ. Which muscles is the surgeon likely to encounter between the two carotids? So between the external and the internal carotid, we find two muscles. That's the styloglossus and stylopharyngeus. That's a very important MCQ. The muscles encountered between the two carotids are styloglossus and stylopharyngeus. It's not stylohyoid. It's not stylohyoid. Stylohyoid is very superficial. The posterior belly of digastric is superficial to the external carotid also. So muscles between two carotids is, this is a very important MCQ, styloglossus and stylopharyngeus. Okay, answer this. Wrong statement about the external carotid artery. Maxillary artery is a terminal branch. Yes. The two terminal branches, maxillary artery and superficial temporal artery, they are given in the parotid gland. Correct. Ascending pharyngeal is a medial branch. Yes, and that's also the first branch of external carotid. Correct. Superior thyroid artery is the first branch. Yes, it's the first anterior branch. First anterior branch is superior thyroid. So what is the answer here? Anterior ethmoidal artery is a branch. No, the anterior ethmoidal artery is a branch of internal carotid artery. It's a branch of internal carotid. Anterior ethmoidal is a branch of internal carotid artery. Clear, students? So I hope this carotid triangle is clear to you, students. Clear to all of you? Yes. So just remember the boundaries as we have discussed. Just remember that the various triangles, the boundaries, this is asked in the MCQs. The anterior triangle is the muscular triangle, that is very important. The carotid triangle, digastric triangle, we'll see in the submandibular gland. That is an important topic. We'll see there. Submandibular triangle, not so important. Only some lymph nodes present here. What is very important is the posterior triangle. Plenty of MCQs you get in the posterior triangle of the neck. Clear, students? I hope this topic is clear to all of you. In case of doubts, do get back to me. Thank you and happy learning. Thank you.